I'm worried this might be creating a monopoly. So that's a direct quote from the chair of the Health Provider Services Committee that's seeing Indiana Senate Bill 282 on compounding of medications, and specifically it seems like they're targeting GLP-1s in this conversation. So I'm Maria. I do content around access to GLP-1s and highlighting the news and the research that's going on in this space as well. So I went to this hearing yesterday in Indiana, and it was introduced on Friday, so people were scrambling to attend and learn about this bill in the 4 days before it was actually being heard. So I got down there, it was a full room. People were actually standing in the hallway trying to get in and listen as well, but I got there early enough that I was inside the courtroom the entire time. There were 19 testimonies. It took over 2 hours to hear, and the committee was rushing people, trying to get them to say their testimonies quickly because they had a time limit. Basically, they had something else to do, I guess, but it was busy. And that first quote about worrying about a monopoly comes from the chair of the Health Provider Committee, Charbonneau. He actually introduced this bill, and you would think, oh, he took money from Eli Lilly and he's biased and whatever, but he said a lot of quotes that were quite receptive. So this is a highlight of what actually happened in the courtroom yesterday. You can go to my Substack to see a full breakdown. And if you want all of my notes, I am more than willing to share them with you. Send me a message and I'll share you my link for my full breakdown of this 2-hour testimony. So there were a lot of different actors in the room listening to this and testifying. There were people who were very obviously from Big Pharma or from manufacturing that were very pro this bill. There were compounding pharmacists everywhere who were very anti this bill. And then there were some people that were in the middle as well. And at the end of all this, the bill did not sail through. It didn't go. It's being held for at least another week because they want to make changes to it because there was so much feedback about different parts of it that weren't good. So the first testimony was the longest testimony, and it was like 20 minutes plus. It was huge. It was supposed to be under 3 minutes, but this guy kind of just went out and talked about how compounding is evil and dangerous and vilifying it and stealing money from the Indiana economy, and like the spinal case in Massachusetts that somebody died from a compounded med like 40 years ago. He referenced that. Somebody later fixed his reference and said that would never happen here because of the regulation that already exists. But really interestingly, his testimony and some of the other testimonies mentioned exact quotes from lawsuits, knockoffs, cheap, Eli Lilly's providing world-class healthcare. All of this is referenced. The spinal case is also referenced in a lot of the lawsuits that Eli Lilly is currently pushing against other people. And probably one of my favorite quotes from a testimony was from a compounding pharmacist in Indiana who was wonderful. His name was Jeff. He said it's like this bill is being written by a competitor. And then he further doubled down on this quote to say,